almost scrawny young lad. I think most people would look at him and think, hey, that's a big, strong guy. But it's interesting, he doesn't see that when he looks in the mirror.
With the gym open for the day, Ray has to get to the local hospital trust by 8 a.m. to get on with his day job as an IT manager.
How long have you worked here for?
12, 13 years. Don't always take annual leave, and that is my choice. It's no pressure on me to do that.
So, thank you. Cheers.
As well as working an intense 45-hour week,
Let me get your chair.
Ray is also on call through the night, 2 weeks out of 4.
So this is basically where I spend most of my time throughout the working day.
OK.
Sat here, typing away, looking busy. And it's the most I've ever seen these working now. And...
What's your perception of Ray?
It's a bit of a wrong, isn't it? But he's all right, yeah? Don't look in his drawer for all his drugs.
Yeah. And that's not actually I do have painkillers.
Oh, I see, right,
That's what I do. I do have that. Like I say, not a lot of people know about my ailments as such. But I do have painkillers on set. I'm just thinking for when I do have, you know, because again, it's sort of take a few pills, still sat here, have a drink, and off I go. It's not something.
So you don't want to, you know, you won't go off and have a walk and have a stretch around. You'll just pop a pill and keep going.
Yeah, go, definitely, yeah.
Sure. So you're spending a lot of your day sat down.
Yeah.
Like over a third of men in the UK, Ray is inactive at work and regularly sits at his desk for several hours at a time.
So standing for even 4 or 5 minutes, the pain comes on.
Straight away, yeah.
Sitting relieves the pain.
It kind of relieves, yeah, definitely.
But then when you get up from sitting,
yeah,
you can feel really, really stiff.
Yeah, definitely, yeah.
OK, so there's clearly something not quite right there. He has a full life, there's lots of things going on, he cares about other people, his job, he doesn't take his annual leave. I noticed a passing comment on, don't look in his drug drawer, and as Ray pointed out, he does actually have a drawer of pills where if he's having any pain, he'll take a painkiller. He doesn't want to bother anyone, he wants to just crack on and get the job done. In view of what I've been finding out over the last day or so, more alarm signs for me.
At 5 p.m, Ray's still on the go and back down the gym for his daily workout.
So I think once I get through the door, it's that escapism. It's that forgetting everything that's gone out through the day. So I use it as Ray time to get away from everything.
In an average week, Ray can rack up 14 hours of weightlifting. But given his pain issues, seeing him put his body through so much stress is clearly a shock for Rangan.
Do one more set on there, then I've done my 3 sets of 10 then.
It's misleading to think that is healthy. This may surprise people, this may surprise Ray, but I would say at the moment he's better off coming home and sitting on the sofa than doing that. Do you feel the pain after?
Not directly after. Again, I tend to find just go home, shower, have some tea, and then it's relaxation time.
And that relaxation time, is that when you feel the pain?
Yeah.
Yeah.
As I'm training, can't feel it.
It almost seems as though you shut it out when you're getting on with your stuff. You're getting on with your job, you're getting on with your training, and it's only when you just sit down and go, actually, I'm in a lot of pain.
Yeah.
Ray's lifestyle could be contributing to his pain, driving his dependence on painkillers. But before he addresses this, Rangan would like to run some medical tests to check for any underlying problems.
Actually, shall I get the red one?
They don't have
I'm not expecting to spill it, but OK.
A blood test will measure a number of things, from the condition of his muscles to his cholesterol levels.
That's a big muscle. I'm just wondering if it's going to fit around there.
High blood pressure is a major cause of heart disease and strokes, and can be brought on by a number of factors, including physical and psychological stress.
A smidgen high, actually. Normal blood pressure, I really want to see about 120 over 80.
Because Ray's been taking so many painkillers for so long, Rangan's concerned about dangerous side effects. He's back at home doing some research.
My long-term goal has to be to get Ray off these opiates, but to do so, I really need him pain-free. What's really worrying me at the moment, though, is he's taking over the recommended dose of over-the-counter drugs such as ibuprofen, but also paracetamol, and that can cause permanent liver damage. I think the best thing to do would be to take him to see a liver specialist and to get a scan done.
Unintentional paracetamol overdose is the most common cause of acute liver failure in the UK.
Thank you. The liver's the one thing that possibly could be a problem. I'm a bit unsure, you know, it may find something. And if I'm being honest, this is the biggest fear.
Ray Ashton?
Yeah.
Come on in.
Hello.
Ray is having an ultrasound. This will reveal any damage caused by his overuse of painkillers.
At the moment, I'm looking at your liver.
The body is dependent on the liver to manage chemicals circulating in the blood. Taking too much paracetamol can damage the cells in the liver, leading to failure.
And breathe away. Okay, and come and lie flat. And we're done.
Yeah.
The scan is complete. Consultant hepatologist Dr. Michael Hennigan has Ray's results.
Hello, Dr. Hennigan.
Hi, nice to meet you. Michael.
Hello. Dr. Chatterjee, this is Ray.
Ray, good to meet you.
Pleased to
How
meet
are
you.
you?
Thank you very much.
Nice to see you today.
No, it's nice to see you. Hopefully.
I have to say that your story frightens me in many respects because I've rarely met someone who actually has as much paracetamol and as much ibuprofen on a sustained basis. And it seems like you have gotten into a habitual pattern or a habit of taking these drugs. And although paracetamol in itself isn't necessarily addictive, obviously you feel better when you take it. You've had an ultrasound earlier in the day and your liver is actually in remarkably good condition at this point. And I would reiterate that it is at this point. If this continues at its current level, it's really just a matter of time before things take on a life of their own.
Yeah.
Okay.
Yeah.
Yeah? Well, thank you so much. I really appreciate your time. Thank you.
Thank you very much. Thank you.
Thank you.
How's that?
Shock, you know, when you hear it anyway, it's quite blunt, but...
Does it worry you?
Without a doubt, I think Hugh was the one that worried me first, the other day when in the kitchen, seeing a GP look at me and go, you know, your head was nearly in your hands. It was like, oh my God, so that shocks me,
It was
to be honest.
like,
and that was exactly the same thing.
He was shocked as well. I mean, it was, you know, it was almost like, wow.
Already I feel now I could go home now and not touch painkiller again in my life.
I'm
That's how I
seriously
feel.
delighted to hear that, and let's see if I can help you do that.
Yeah, definitely.
I think that doctor was very, very clear. This is serious. If he continues to do what he's doing now, he'll be back in there within a couple of years. What I find difficult at the moment with Ray is that I'm bonding really well with him. And by doing that, actually, my authority as a doctor, it's still there, but I feel it's lessened in some way, that I can't really deliver him the same information as I would if I was back in the surgery. And so actually hearing that news from a different doctor, who he does have no bond with at all, I think that will have tremendous value for him.
It seems that Ray is starting to get the message about the dangers of painkiller abuse. Rangan is back at home, and he's switching his attention to Ray's 5-year-old son, Lucas, who suffers from eczema.
I've got a son who I managed to get eczema-free by looking at environmental factors, gut bacteria, and the quality of his diet. I really hope that that kind of approach is actually going to get Lucas's skin much better, but I need to investigate a little bit further.
The first thing Rangan wants to do is to take a closer look at Lucas's skin.
You see where you've got itchy skin?
Yeah.
It's like a big magnifying glass here, so if I put it on, we can see a picture of your skin. Right, that's the light on. Is it funny?
Yeah.
It's not meant to tickle. Did it tickle you?
Yeah.
Do you know what doctors call it?
No.
We call it something called eczema.
Yeah. Called it some eczema.
Do
Eczema.
you want to say what eczema is?
Yeah.
Eczema is a skin condition that causes your skin to be dry,
itchy and red. That's your skin, isn't it?
Yeah.
So, I don't know if you can see how dry the edges are of that
Yeah.
spot. Obviously, when you can see in detail, it looks quite raw there, doesn't it?
Yeah.
The reason your mum tells you not to itch it, you see that top barrier of skin, the top comes off and it gets all red and itchy, doesn't it?
Yeah.
It affects 1 in 5 kids.
Yeah.
And 1 in 12 adults. We're seeing it a lot these days. We don't know the exact cause of it. We know it's a mixture of genetics, but also your environment can be different in each person.
Yeah.
Can I have a look at the creams that he uses and
Yeah.
the emollients that he uses for his eczema?
Rachel relies on a variety of creams to relieve Lucas's symptoms. This includes a prescribed moisturiser kept in his bedroom.
His other one is in the fridge because it's had to keep it in the fridge.
Okay, any other emollient that he uses?
No, that's it.
Just
That's
this
the only one, yeah.
This is the cream you use every day?
Yeah.
All over the body?
Just on his patches, I use it, to be honest, on his back of his legs and his arms and his face.
And do you find it
around his
useful?
ears. I do think it helps, yeah.
I always encourage patients to use the emollients as much as possible,
Yeah.
even when it's gone.
Yeah.
Because it just keeps the skin hydrated and moist
Yeah.
and healthy, and it just means you're less likely to get flares.
Yeah, yeah.
Not impossible, but
Yeah.
it's just less likely.
Yeah.
So I think it's really good.
These sorts of creams treat eczema symptoms, but Rangan wants to try and tackle the underlying causes of Lucas's problems.
Eczema is a very complex disease. We don't know everything about it yet. There are many different causes, and often more than one cause in the same person.
There could be multiple triggers around the Ashtons' home. First up, washing detergents.
I'm looking for biological versus non-biological. We know with some children and some adults even with eczema, they're better off with non-biological
Yeah.
powder. Have you ever heard that?
It's never made any difference, so I just generally just buy whatever I buy. This is Lucas's bed.
Can I have a look at the sheets and see what they're made out of?
Yeah?
Materials such as wool and synthetic fabrics could be contributing to the problem.
Typically, we try and recommend 100% cotton sheets. Again, I'm not saying that these are contributing. It's just we know that they can in some people, so I'm just trying to see what possible triggers are there. It's 100% polyester.
Right.
Some soaps, shampoos and other bathroom products might also be making things worse.
Does he have a bath, and do you put anything in the bath?
He generally has a shower now, so he's in and out. If he has a bath, I don't put anything in it.
The bubble baths, they
Yeah.
can really dry skin, they can irritate it and make it worse. Did you find that with Lucas?
Yeah.
There's one final area that Rangan thinks might be a big player in Lucas's problems:
This one.
This one.
his diet.
Is that your favourite?
Yeah. Strawberry.
Strawberry.
Lucas struggles to eat enough fresh fruit and vegetables,
Would he ever eat strawberries?
No.
and much of his diet is based on products containing wheat and dairy. About 10% of eczema cases are caused by foods, and these are 2 known dietary triggers of eczema.
So do you prepare his packed lunch every day?
Yeah, I do. He has more or less the same things every day. Like today, he's having a sandwich, and he'll have a pack of breadsticks, a yogurt, and some raisins, and so that's it. That's his lunch.
Is that your favourite?
Yeah.
Is he quite good with cereal?
He'll eat his cereal at any time of the day.
Was it quite limited what he has then, would you
Oh,
say?
very limited, yeah.
Fruit, vegetables, anything like that?
No,
Not at all?
not at all.
Not
No.
even a banana or...
No.
There's this big thing going off in my head saying, does he have some kind of sensitivity to wheat and dairy? And the only way we would know is by what I'd call a well-managed exclusion diet.
Yeah.
So for a short period of time, exclude some important foods whilst doing other things to see if there's an improvement.
That would be a major thing, though, because that's like what he lives off.
Look at it this way. We could either not do anything and it can keep being a daily struggle for you, or for the next few weeks whilst I'm with you, we can try some things that, yes, will be difficult, there's no question, but they may potentially lead to things getting a lot easier for you quite quickly.
I don't think Lucas is going to be up for the diet changes at all because he finds it really hard to try new things and stuff. So to me, we can't really take anything away without replacing it because otherwise he won't be eating. And if he doesn't eat, then he doesn't sleep. So I just think it's going to be really hard. And I'd be it's not that I don't think it would work. I think we're going to find it really hard to make the changes.
I'm concerned about Lucas's diet. 90% of what Lucas eats is wheat or dairy. These are 2 of the commonest food triggers for eczema, and that's all he's eating. Now, I can't tell you that they are causing a problem, but what I can tell you is that it's definitely worth a short period of time where we